As of this year, 10 states and the District of Columbia allow physician-assisted suicide. MD-assisted suicide or medical aid in dying is when a patient self-administers medication to end their life through means provided by a licensed physician. Competent but terminally ill patients deserve the right to choose physician-assisted suicide to maintain autonomy and dignity in end-of-life scenarios, particularly when suffering without alleviation. There are many people that believe this should not be allowed. However, I believe this should be legal in all states. Assisted suicide gives those who are suffering prolonged periods of time not only their bodily autonomy, but their dignity as well. Without this option, many people have their self ownership of their bodies taken away unethically. Currently, there is no cure for many cancers, ALS, and multiple sclerosis, just to name a few. No one should be forced to suffer through a deteriorating illness, and assisted suicide should be readily available resource for anyone who meets this criteria. Having assisted suicide as a healthcare option in the United States must be mandatory. Healthcare in the United States focuses on many things, autonomy being a major focus in nursing society today. However, with only 10 states allowing medical aid in dying, do patients really have full autonomy? Autonomy has always been a concrete foundation in healthcare. This crucial pillar has numerous benefits to all involved, including patients, their families, and the healthcare team. First and foremost, it leads to patient-centered care, meaning we as nurses are addressing our patients' needs, preferences, and values. Although debates are still going strong, many states have loosened their restrictions on physicians, helping bring a quick and ethical end of life to their patients. Although an uncomfortable change for many here in the United States, passing this bill would be much relief and save the suffering for thousands here in our home. Those who do not need these services should not decide for others. We must not. Our states are firmly divided on medical aid in dying, and that must change. I propose legalizing physician-assisted suicide in all states and territories in our country to match those already set in place with the following criteria. The person must be age 18 years or older, terminally ill with prognosis of 6 months or less to live, able to make their own healthcare decisions, and able to ingest medication without help. Patient autonomy to me is absolutely and without question an unalienable right. Physician assisted suicide to those who meet criteria and make that decision for themselves fall into that category, and I believe no one on this earth has the right to deny that. Every person, man or woman, has the right to bodily autonomy, and the solution to legalize physician assisted suicide gives us that autonomy.